Welcome everyone here to Care Harbor. This is our 12th event on this sunny day in California. We've been in a hiatus for 2 years with COVID, unable to do these events. But the need hasn't gone away, and neither have we. And so we've reimagined Care Harbor. We've redesigned it so that for this pandemic era. We spaced the patient flow out. We're doing our services a little differently. We've changed the air filtration in the building. So we're doing a Care Harbor proof event for the safety of volunteers and patients alike. But we're maintaining the same quality of care that we've always given, and that's our mission. That hasn't changed. And what hasn't changed also is that the resources, the things that make Care Harbor happen are the volunteers and the community people who contribute to this. Lifeblood of Care Harbor is our volunteers. We have probably 200 or 300 professionals in the building today giving up their time to help people who really need their help. It's really a community event. Care Harbor is really us. It's the community coming together to help its own. That's what the magic of Care Harbor is. That's why we keep going. I want to do a shout out to two people who, I think one of them is here, who are among all the volunteers that has been absolutely essential. One is Sasha Marioka, who's part of our team. I don't think Sasha's probably working. Is she here? And the other is Allison Cato, who I see standing over there, who has coordinated all these county agencies. I don't know how she put up with us and all the endless Zoom meetings, but we kind of consider her part of our team too. So I wanted to say thanks to them. I'm very proud to be part of Care Harbor, and the reason why I am is because of the team members that we have. It's really an uplifting experience. People who go through the event are kind of expected to have an emotional upwelling when they see all the patients that are there getting helped. But what surprises people somehow is the impact of all these volunteers giving freely of themselves. It's an emotional experience, and it's really very special. And a lot happens in this building. Lives are changed, lives are saved in some cases. So we're very grateful to all of them. I want to also mention especially UCLA, which is playing a big part in our event this year, and the 2nd District of LA County, which has been kind of our lead, our county lead every year. We're very grateful to them, and I'm very proud that we have the supervisor of the 2nd District here with us today. And I'd like to introduce her, Holly Mitchell. You bet. Let me get my phone.
Good morning. I've had folks ask questions like, okay, so we just heard the announcement, are we still wearing masks? I said, well, when I can have a mask that has UCLA and my Los Angeles Lakers on it, I'm gonna wear this mask. So, because sometimes my Lakers need my help beyond just me hollering at the TV from home. So I'm gonna imagine that me wearing the mask is gonna give them what they need to be the Lakers we all know they can be. So good morning, Don. Thank you very much, not only for the introduction, but for that, but for your partnership. It's very important. Don mentioned that he's proud to be a member of the Care Harbor family. I am proud to be a member of the LA County family. And when two powerful forces can come together, Care Harbor and the county, great things are going to happen here today. I mentioned to Don, I said, oh, it's been a long 2 years. He's like, it's felt like 14. I'm like, yeah, it has felt like dog years. That is absolutely certain. And I'm sure the people that were going to receive services today in care as a result of the volunteerism of the county, UCLA, and Care Harbor have felt the same. So again, let me thank the county departments that are here today. We've got 8 departments providing a variety of services, including Department of Public Social Services, Department of Mental Health, we'll hear from Dr. Sharon shortly, the Office of Immigrant Affairs, the County Registrar Recorder, the County Public Defender, who will be providing record expungement and legal consultation, an important element. DCBA, information on rent control and renters' rights. Department of Health Services, My Health LA, and the Office of Patient Access, Department of Public Health, and Weed Acts that will have workforce information. And so by virtue of the kinds of county departments that are out here and available, that helps us understand that When we talk about health, it's not just the absence of disease. It really is about a comprehensive state of well-being. And the presence of all those various county departments is an example of that. Many of our residents who have and will stand in line today haven't seen a dentist or a doctor in, based on what they told us back in 2019, at least 5 years. And we know that they need the medical care that Care Harbor is bringing to them today, free of charge. Most important 3 words today, free of charge. The 2nd District that I'm proud to represent continues to be hit the hardest by this dual pandemic, public health and economic. So free medical care means so much to my constituents. 15% of my district's residents don't have health insurance, higher than any other district across our county, and would not be able to seek medical care if it were not for free events like this one today. I have constituents in this line who have traveled far and near from South LA, every corner of the 2nd Supervisorial District. And that's why it's important that Care Harbor doesn't just provide temporary medical visits during these 3 days. It will also connect attendees to ongoing care as well. And that's very, very important to me, as I'm sure all of you. The county's Alliance for Health Integration and our county departments of health services, mental health services, public health, social services, again, will be helping to make follow-up care possible in addition to the on-site health services being provided. This event is completely volunteer-driven, and recognizing, some of the fears and concerns people still have as a result of this pandemic, that's an important element that should not be overlooked. It's also a reminder of the resiliency and sense of hope and the ability we each have to apply our skills and talents toward helping each other on days like today and every other day throughout the year. So I want to share my deep appreciation for the hundreds of volunteers and doctors. You will hear from some of them today, nurses, mental health providers, students, and residents who've come together to serve our residents over these next 3 days. They are the true heroes and heroes here today. We're glad that the weather held up today and hope that while we need the rain, we don't want our residents who are coming in for healthcare services to be horribly inconvenienced. So with that, it gives me great pleasure to bring up our next speaker. I'd like to introduce to you Dr. Medell Briggs, Chief of Health Equity, Diversity, and Inclusion at UCLA. This event isn't possible without the support of partners like UCLA Health, who are also this year's premier sponsor. So please join me in welcoming Dr. Medell Briggs, Chief of Health Equity, Diversity, and Inclusion at UCLA Health, and the lead doctor of Care Harbor. Thank you.
Thank you so much, Supervisor Mitchell, and thank you so much to also Don Manelli for the entire Care Harbor event, and of course, all of the UCLA volunteers and the volunteers from also outside of UCLA Health. It is our absolute honor for UCLA Health to be the presenting sponsor for Care Harbor. The reason why this is so important to us as an institution is because it is our obligation and responsibility to promote greater health equity, and this is one of the ways that we pledge and commit ourselves to do so. Now, during the COVID-19 pandemic, we saw even more the disparities and the inequities that exist not only in physical health, but also in mental health and also our entire society. And that has demonstrated to us how it's all of our responsibilities to be very thoughtful and very intentional and make sure that we're providing accessible, high quality, equitable care to every single member of our community. And we also know that the COVID-19 pandemic disproportionately impacted our most under-resourced populations. Those are ones that do not have income coming in all the time or may not have insurance. And that's what this event is all about. So we as UCLA Health, we have actually brought together more than 300 volunteers, physicians, nurses, dentists, as well as specialists in vision, pharmacists, you name it, to bring all of our services here for our community. And we will be here both today, Saturday, as well as Sunday. We expect to serve over 600 people each and every single day here. And as the supervisor mentioned, this isn't a one-time thing. This is about us connecting them to all the additional health services that they need and the social services that they need in order to have the greatest level of both health and overall wellness. One of the things that we're also very proud of as UCLA Health is that this is the first Care Harbor event, which we've also incorporated our new homeless healthcare vans. And so we have a homeless healthcare collaborative in which we have vans that go throughout the community in order to provide, again, highly comprehensive, high quality, equitable care to those experiencing homelessness throughout the greater Los Angeles area. And through our vans, we get to meet our community members where they are and address their medical and social needs as well. And so our vans are here today to also provide additional support to all of the people coming in to receive care services here at Care Harbor. So it is our absolute pleasure to be the presenting sponsor. It's our absolute pleasure to serve our community. And we want to just thank everyone who has volunteered their time and their expertise, and most importantly, their compassion to all of our community members. So thank you so much.
Dr. Briggs mentioned 300 volunteers who are going to participate today. And so following on that, I want to introduce you to a supersonic volunteer who's volunteered for 9 years running. Kevin Kim, his day job, he's admin staff in the Division of Cardiology at UCLA. Kevin Kim.
Hi, good morning. Thank you very much for the opportunity to share my experience in being involved with Care Harbor. I just wanted to say thank you very much to all of the different entities and Don Manelli for organizing this event year after year. It's been a great honor to be a participant and to play just a small part of the hundreds of volunteers that support our community. In the past 9 years that I've volunteered, I've had the wonderful opportunity to meet members of our community and see them benefit from the services and all of the different coordination and collaboration that an event like this requires. And having the opportunity to see people and see the relief on their face after they get care that they deserve, and to see their smile and pain alleviated when they get dental care that they have been waiting for so long, has been something that's really been a profound experience for me. And so over the years, I've come to acknowledge what a critical component events like Care Harbor play in our community. And I want to extend my deep appreciation for the support of events like this to supervisor and all of the other entities and the volunteers that make this event possible. So I appreciate you all for shining a light on this Care Harbor and all of the benefits that it brings to our community. Thank you so much.
So Kevin, thank you. When you think about the woman and manpower hours, 300 volunteers, 3 days, that's really significant. And so last but not least, representing the perspective of the county family, again, we heard Dr. Briggs talk about health and social services, and one key element of health, particularly now, is our mental health. So please join me in welcoming Dr. Jonathan Sharon, Director of LA County Department of Mental Health, to talk about the critical life-sustaining services that his department and other county departments will be bringing to bear as a part of Care Harbor for the next 3 days. Dr. Sharon.
Thank you very much. What an honor to be here. I was here previously before the pandemic, and have always found this to be a very inspiring and heartwarming event. And for me, being here and kicking this thing back up again is an indicator of recovery. It's an indicator of recovery for this county and for our communities, and we need to roar back in a really, really thoughtful and informed way going into the future. The thing I love so much about this event is that it's a real-time event. And in a perfect world, we would have real-time events all over this county every day. And we would be providing a level of access that would be unprecedented, particularly for people who don't have access for a variety of reasons, including the inequity of our structures as a society. We have collective challenges, and we need to meet them as a collective. And the different players here involved, including the health departments, support from the supervisor, from UCLA, from Don, the Care Harbor folk, that's an example of a collective response to a collective problem. I want to thank everybody. I want to thank Don and his team. I want to thank Jacqueline Balcom and the Alliance for Health Integration for helping coordinate amongst the health departments. I really want to thank the Department of Mental Health, Crystal Cianfrini, who's been our lead. We're providing real-time counseling, and we're connecting people who have mental health needs with services ongoing, which is a big, big deal. And if we're not getting the memo about the importance of mental health to function in a family, in your job, as a person, then we're never going to get it. Lastly, I want to thank my boss, Supervisor Mitchell, who I had the honor of getting to know a bit when she was up in Sacramento. And I just want to say that this is a leader with courage and with strength and with conviction. And she is lifting heavily, which puts a big-time burden, but a positive one, on the departments to carry our water. And we are going to be doing that. We're doing it here today. We're trying to do it across the county because the needs are so high. So I thank you, and it's such an honor to work for you, Supervisor Mitchell.
Thank you, Dr. Sharon. You know, the feeling is mutual, and you're right. I do have high expectations of these county departments because you have shown the county stood up and delivered these past 2 years on behalf of close to 11 million county residents who were looking to us for leadership. It's a time such as this, in my opinion, where government is supposed to stand in the gap and partner with Don and all of the volunteers and all the agencies who are here today to bring critical services to people who need it. So back in 2019, this event, there were 1,960 doctors and medical students that provided 6,700 medical services to 2,100 patients in need, many of whom had not seen a dentist or doctor in over 5 years. More than 50% of the patients were residents of the 2nd District. 30% of the services received were dental, 32% received vision services. 60% of the patients were unemployed. It will be very interesting, given the impact of this pandemic on all of us this last 2 years, to look at the demographics of who served, what services were received, and I know we're going to exceed those numbers, as significant as those were.